to the National Consultative Conference on Rare Diseases. It's so good to see so many of you here today. I think we've got a full house despite the lovely weather outside, and maybe we'll get a chance to go out to the gardens later on. So I'm going to get started straight away. And Minister, you've been very supportive of the work of the Rare Disease Group, and it's now my great pleasure to invite you as Minister for Health, Dr. James Reilly, to formally open our conference on rare diseases. Thank you, Minister.
Good morning, ladies and gentlemen, and it is indeed a pleasure and an honour to be here today, and I want to welcome you all here to Farmleigh, which in the worst of weather is a stunning setting, but when the weather's such as it is today, it's quite amazing. I'm delighted, though, in the main, that this consultation process that's taking place is very much involving patients and their families, as well as the experts in clinical research, industry and health policy. Patients and their families know the strange process that comes before diagnosis. The shaking heads, this doesn't make sense. The countless therapies tried that don't seem to yield any result. The sense of being on the right track, when often it turns out to be the wrong track. And then at last, the diagnosis. You're only one of so many in the world. You or your child is almost unique. But that, sadly, is a uniqueness nobody wants for their child or themselves. And as you know, member states within the EU are trying and are required to develop a rare disease policy by 2013. Here in Ireland, we're developing a specific national plan and working with our European partners to improve health and social care for people with rare diseases. We're part of Europlan and we participate in the Commission Standing Committee on Rare Diseases, or UCURD as it's known. In January 2011, a national conference was held here in Farmleigh with the support of Europlan. Patients, patient organisations and healthcare professionals met to discuss what might feed into the development of a national strategy for rare diseases. 2 months later, I established a national steering group to develop a policy framework for the prevention, detection and treatment of rare diseases. The policy, like everything we set out to do, starts with the patient, is based on equity and concentrates on quality of care. It will operate over a 5-year period, supported by a dedicated clinical programme. A national clinical programme for rare diseases will improve and standardise patient care by bringing together clinical disciplines so they can share innovative solutions. Management and clinical leads for the new programme are currently being identified. And I think this is very important because we know that when we do put a clinical programme in place and we get all the various people involved talking to each other, that we can improve outcomes for people. In any disease area, and I think the NCCP have proven this, that's the National Cancer Control Programme, improved management and organisation improves outcomes for patients by 10%. Nothing to do with medication, just the organisation of their care. And who knows better what the needs of patients are than patients themselves and those who love for them and care for them. So what we want is action, but we want it based on a robust, achievable, realistic plan. And that action includes providing better information for patients, designating appropriate centres to provide high-quality treatment, setting out a fair and transparent means to allow access to orphan drugs, and promoting research for the benefit of patients with rare diseases. And that's what I'm looking for from the group. It's chaired by my department and it pulls together organisations with a remit or a special interest in rare diseases. When this group was being established, I felt it was important that people suffering with rare diseases were included in the group, and I'm really pleased that that has happened. And the national steering group's currently looking at everything from centres of expertise, orphan drugs and technologies, research and information to patient empowerment and support. And I understand that progress to date in these areas will be outlined for you later in this morning. But I really do want to emphasise the role of the patient and the families in the organisation of a service for those who are the main consumers of that service. I think for too long in the past we've had doctor knows best. Well, doctor doesn't always know best. Doctor may have access to a huge amount of information, but patients and their families know best how that information can benefit them in their particular instance. And you can't get a more particular instance when you have a rare disease. So today's event is in effect a consultation with you regarding progress to date and preparation for the final phase of the plan's development. As well as today's consultation, the online survey on the HSE website gives a further platform for anyone with a rare disease or anyone who cares for someone with a rare disease to share their views and have an input into the plan. And of course, very importantly, we do look forward to hearing from clinicians, healthcare personnel, researchers, anyone who works with rare diseases. Basically, what we're about is to positively impact on the health, well-being and daily lives of people suffering with rare diseases. Today's process will be an invaluable part of those efforts, but I think we all here, clinicians, the department, families, patients, have to use all of the energies and all of the facilities that are available to us, including the internet. We know in the past people have made small discoveries that have had a huge impact on maybe a small number of people, but that information just was not passed out quickly enough to the remainder of the services and those who suffered so that more people could benefit. The internet overcomes that today. I think we need to share more information between professionals and patients and families, and I think that's the way to a brighter future for all who are concerned with those who have rare diseases. Thank you very much.